Continuing on, Chapter 15, Stroke Medications. Thrombolytic medications, Retiplaz, recombinant, give within 4.5 hours of initial manifestations for clients experiencing ischemic stroke due to embolic event as evidenced by CT scan results. Anticoagulants, warfarin. Warfarin is indicated for clients who have atrial fibrillation or cardioembolic stroke, which with a target international normalized ratio INR of 2 to 3 times, which is secondary prevention. Anticoagulants should not be used in hemorrhagic stroke. Novel oral anticoagulants, NOACs, such as dabigatran, apixaban, and rivaroxaban, are alternative medications to warfarin therapy for clients experiencing atrial fibrillation, cardioembolic stroke. Antiplatelets are medications used, such as aspirin, dipyridamole, and clopidogrel, which is Plavix. Low-dose aspirin is given within 24 to 48 hours following an ischemic stroke to prevent further clot formation. Platelet inhibitors such as dipyridamole, clopidogrel, Plavix can be given to clients who have experienced thrombotic or embolic stroke. Anti-epileptic medications such as phenytoin and gabapentin. These medications are not commonly given following a stroke unless the client develops seizures. Gabapentin can be given for paresthetic pain in an affected extremity. Moving on to therapeutic procedures, on page 90 of Chapter 15 is systemic or catheter-directed thrombolytic therapy restores cerebral blood flow. It must be administered within 6 hours of onset of manifestations. It is contraindicated for treatment of a hemorrhagic stroke and for clients who have an increased risk of bleeding due to anticoagulant therapy or other bleeding anomalies. Possibility of hemorrhagic stroke is ruled out with an MRI prior to the initiation of thrombolytic therapy. Carotid artery angioplasty with stenting, CAS, involves inserting a catheter in the femoral artery and placing a distal embolic protection device to catch clot's debris during the procedure while a stent is being placed in the carotid artery to open a blockage. CAS, carotid artery angioplasty, is less invasive, blood loss is decreased, and length of hospitalization is shorter. Post-op care is the same as carotid endarterectomy. With carotid endarterectomy, this is performed to open the artery by removing atherosclerotic plaque. This procedure is performed when the carotid artery is blocked or when the client is experiencing TIAs. Assess for increased headache, neck swelling, and hoarseness of the throat. Extracranial intracranial bypass is a craniotomy performed to improve cerebral perfusion following a stroke or for clients who have had a TIA that is likely to progress to a stroke. It increases blood flow around a blocked artery and can help restore blood flow to affected areas of the brain. Interprofessional care. Speech and language therapists can be consulted for language therapy and swallowing exercises. Physical therapy can be consulted for assistance with reestablishment of ambulation with or without assistive devices, single or quad, cane, walker, or wheelchair support. Wheelchair adaptations and extended brake handle on the client's affected side of the wheelchair can be necessary. Occupational therapy can be consulted for assistance with reestablishment of partial or full function of the affected hand and arm. If function does not return to the extremity, measures such as massage and elastic gloves will be prescribed by occupational therapy to prevent swelling of the extremity. Social services can be consulted to make arrangements for rehab services and temporary placement on skilled rehab unit or extended care facility during provision of these services. Prior to discharge, the social worker can make a home visit with selected therapists and nurses to evaluate the need for environmental alterations in the home and adaptive equipment needed for ADL. Going on to complications with stroke, you have dysphagia and aspiration. Dysphagia can result from neurologic involvement of the cranial nerves that innervate the face, tongue, soft palate, and throat. As a result, the client's risk of aspiration is great. Not all clients who have experienced a stroke have dysphagia, but all should be evaluated prior to reestablishing oral nutrition and hydration. Nursing actions are to assess gag reflex. If the gag reflex is present, give the client a small sip of water to determine if choking occurs. If the client exhibits difficulty managing food or fluids, a swallowing evaluation should be done by a speech pathologist or speech language therapist or speech language pathologist. Keep the client completely NPO until evaluated by the SLP, speech language pathologist. When resuming intake, provide the client with the prescribed liquid consistency regimen from the National Dysphagia Diet and observe closely for choking. Have suction equipment available, but feed with care because nasotracheal suctioning increases intracranial pressure. An RN should provide the initial feeding and intervene if choking occurs. Some clients require an eating environment without distractions to prevent choking. Client education for the complications would be to use recommended techniques for eating and adhere to instructions regarding prescribed consistency of liquids and solid foods. Sit upright and flex the head forward when swallowing to decrease the risk of choking. Another complication possibility is unilateral neglect. Unilateral neglect is the loss of awareness of the side of the that's affected by the stroke. The client cannot see, feel, or move the affected side of the body, therefore they forget that it exists. The lack of awareness poses a great risk for injury to the neglected extremities and creates a self-care deficit. Nursing actions include observing affected extremities for injury, bruises and abrasions of the affected hand and arm, hyperflexion of the foot from it falling off of the wheelchair during transport. Apply an arm sling if the client is unable to remember to care for the affected extremity. Ensure that the footrest is on the wheelchair and that an ankle brace is on the affected foot. Client education is dress the affected side first, care for the affected side, use the unaffected hand to pull the affected extremity to midline and out of danger from wheel of the wheelchair or from hitting or smashing it against a doorway, and look over the affected side periodically. Here is an example of a communication board. Yes, maybe, no. I'm in pain, choking, shortness of breath. I want water, ice. A way to communicate with stroke patients. This completes page 91 of Chapter 15, Stroke. Don't forget to do the application exercises at the end of Chapter 15 when studying.